I'm going to enlighten you on what is corona, whether we really need to panic about this corona or not. Corona is basically a virus. We call it a respiratory virus since it affects our respiratory system. You know, respiratory system starts from nose, ends at the lung. Usually it affects anywhere between the nose to the lung, but commonly it causes fever, cough, body pain, breathing difficulty, we call shortness of breath. Sometimes, rarely, it can cause us running nose, sneezing, as well as other symptoms in the form of vomiting, diarrhea, other things can happen there. Who are all the people are dying? People who are above the age of 60 or 70, they got some medical problem like sugar, heart problem, asthma, wheezing, or people got liver diseases, kidney problems. They are the people most vulnerable for these infections, as well as death is more in this population there. Regarding treatment, is there any treatment? Most of the viruses, they don't have any specific treatment there. For example, dengue is one of the common virus. There is no treatment for dengue. We are giving symptomatic treatment in the form of fever medications, in the form of some rehydrations and other thing there. Similarly, this virus is also 85% it can cause us fever, cough and body pain. Any other viruses, so we are giving a symptomatic treatment only, like fever medicines, paracetamol, or some body pain medications we used to give it there. But if the person required pneumonia or going to the ICU or hospitalized, that point of time there is no approved drug from any of the authorities like Food and Drug Administrations, FDA we call. They are not given any approval to use any drug there, but people are doing trials, different virus medications available in the market. For example, so influenza medications, oseltamivir, we are going to try it there. Similarly, for HIV, we are using a medicine called lopinavir ritonavir. That medicine is also going to try, and US is trying on new virus medication called remdesivir. They are going to try this type of medicines is going to try there. How about vaccination there? Right now, no vaccines available to prevent this infection there, but soon it's going to be available. Soon means minimum 9 months to 12 months is a time period there. But what is wondering has is right now influenza is also we are seeing there. Swine flu cases and influenza cases we are seeing. That also causes similar manifestations. People are getting admitted, people are going to the ventilator. Number of deaths also reported with influenza. Vaccine is available for influenza, but unfortunately people are not taking it there. Anybody above the age of 6 months, we need to take influenza vaccine once in a year, not one time in a life. Once in a year is supposed to take it. Then what are all the ways we can prevent it? First and simple most thing is any unnecessary travel or unnecessary travel to crowded places. Not necessarily you should go out of country or within country. Going to the crowded places itself is better to avoid. That's a simple thing there. If you need to go to the crowded places, don't touch unnecessary surfaces or frequently touch surfaces. You need to be conscious about what are all the surfaces people are handling frequently. Try to avoid that surfaces. If you are touching the surfaces because of the circumstances, we need to wash your hands either with the water, simple water. Carry some water bottle with you, carry with the water that you can wash and after touching the surfaces, or if you got alcohol hand rub or something, that is also fine there. Then don't take your hands near the face. That's most important thing there. Touching some surfaces, bringing your hand near the face, that's most culprit there. So try to avoid these simple things. Then if you are sick, suppose you got fever and cough, don't get panic, don't think this is corona there. It may be ordinary viral flu or ordinary common cold also is possible. Take some paracetamol, take rest, don't go to the work from home is possibility, work from home is also fine there. Take sufficient rest, see how it goes. If the fever goes more than 3 days, you need to contact. Or if the fever is very high, you are not able to do your routine activities. For example, walking, talking, you are not able to eat your food or something there. That point of time you need to contact doctor either by the phone or in person, because nowadays try to avoid crowded places. Hospitals are one of the crowded places nowadays. People are sick, you are going to the crowded places, you need to wear mask, not other people. For example, general public, it's a great ban for mask. Mask is not available for even from the hospitals there. So better to avoid mask for general public. Leave the mask to the healthcare personnel or people who got sick. The persons who got some cough and cold, they're supposed to wear the mask. Otherwise, it's not for everyone there. Only for healthcare personnel, we're supposed to wear the mask. And don't shake your hands. That's most important thing there. And cough. Previously people used to cough in a hand, but now we need to slightly modify our cough behavior. Flex your elbow, cough in your arm. And similarly, any door if you want to open, if you try to open the door by elbow method rather than pushing this way there. And don't shake your hands. And Indian culture, we are saying namaste or vanakkam is much better choice compared to other thing. With these tips, definitely you get away with corona. No worries.